Okay, so let's start over chapter 6. Chapter 6 is about emerging technologies, upcoming technologies, futuristic technologies. Some of these technologies are already deployed, and some of the technologies are still in research phase. So we have three agenda items in the first part: healthcare application, cloud-based application, autonomous system. So let's start with the first healthcare application. Uh, the first healthcare application is smart contact lens for diabetic patients. Google and Novartis International, they just teamed up and have developed smart contact lens for diabetic patients, so they can measure their glucose level without harming themselves. It measures the glucose level through the tears and then sends data to smartphones or you can say other connected devices, so they can actually measure the level through the tiers and then send the data to the connected devices. uh, Google has already filed the patent, so you will see these particular lens shortly in the market. Then smart hospitals information management, just to co-locate the information of patients. Company is IBM. IBM has invested in this technology and they have designed two main software. First is called IBM Watson. IBM Watson has a broader spectrum. Mainly, or you can say currently IBM Watson. It's basically it co-locates. You can say co-locate the patient's information, or you can say for full disease scanning as well. Diseases scanning. It's still learning from the computers and other devices. IBM Watson and another software which IBM has designed for hospitals is called Avicenna. Avicenna is basically a CT scan reading software which assists the radiologists to read CT scans to suggest diagnosis and treatments. It will actually reduce the human error that can make. So basically Avicenna is specifically designed for radiologists, so they can read the CT scan better and they can suggest the other treatments and all that stuff. The next healthcare application which is right in place, it's the surgery robots. The company is the Vinci Surgical System. They have already started performing surgeries, all type of surgeries using robots. But again, those robots, they don't actually do autonomously, or they are not basically artificial intelligence based robots. All the robots are basically 100% in control of a doctor. So they actually, rather than using their own arms, rather than using their own instruments and all that stuff, they use the wrists or instruments of a robot. So the company is Da Vinci Surgical System. The Vinci Surgical System performs all types of surgeries using robots. And the best, you can Google it, the Vinci Surgical System, and you will see a good video which will show you the accuracy and precision of these robots. Another thing is the robots have 3D magnified vision system and tiny wristed instruments that can rotate and bend far greater than a human hand. So these are more small, more tiny as compared to human hand as well. Other than that, they operate through small and few incisions. incisions, and robot is 100% in control. So 100% there is a doctor who is controlling that robot. This is another technology which is coming in. Next is the medical UAVs, unmanned aerial vehicle. These are basically gliders and called ICRIS. ICRIS, it stands for inbound controlled air releasable unrecoverable system. Unrecoverable system. So these particular UAVs are gliders. These are basically gliders with no built-in motors. So they don't have any built-in motors. We actually use we actually release these particular gliders in the mid of the air to actually deliver the urgent medical supplies in you can say where the ground transportation is not possible. So these drones made up of cardboard and can be used to deliver medical supplies in remote areas. Remote areas or areas where ground transportation is not possible. And they actually glide. I mean, you just have to release these gliders right in the mid of the air, and they can automatically glide, and you can control their movements or landing through on-chip sensors. On-chip sensor, and we can deliver the critical medical supplies in these kind of area. Then the next healthcare application is robotic checkups. The best part of robotic checkup is it will reduce the healthcare cost. Because rather than interacting with a human, you just have to interact with a robot. That particular robot can perform routine checkups. They can do the follow-ups and can access the medical reports and history of a patient. And for example, if they detect any anomaly or any emergency, they can also send alert to doctors. The leading company is InTouch Health. Is basically the leading manufacturer of these robots, the medical robots. Another the healthcare application is nano robots. These nano robots can be, this is something, a new idea. In fact, this is not in place. Still some research is going on. But what is basically a nano robot? Definition is, nanorobot is a machine which can build and manipulate things at nanoscale within human body. So these are very small kind of sensor that can be injected in body or that can be embedded in body. What they can do is, these nanorobots after entering body, they can detect diseases and can repair the damaged cell. They can repair the damaged cells as well. Other than that, they can also carry medications. What else they can do? They can be, as I mentioned, can be implanted or injected. So these are basically very, very small kind of machines, very small kind of small robots that can actually walk through the human body, and then they can repair the damaged cell and detect the diseases, and a doctor can monitor the activities through a computer, because they respond back to computer as well. And of course they can destroy themselves after the mission. So after the mission, they can actually destroy themselves. They can get out of the body through the natural ways. Next is the smart medical wristband. This is basically a smart wristband which Google has designed for patients. And these particular wristband, they can measure the temperature and some other factors of a patient and send alerts to the hospital servers. And of course, doing that, doctors can actually keep an eye on their patients by using these smart wristband. So the company is Google. So Google has designed the smart health monitoring wristbands for patients. It's not for commercial uses. Patients, which is connected with hospital server, sends the data to hospital server, and measures the patient's body temperature. It can measure their heart rate, blood pressure, some other factors which could be important for a patient. So by using these particular data, a doctor or physician can actually keep an eye on their patients. Next is the skin hearing. This is a project which is initiated by Facebook. So Facebook has invested in this technology. Facebook has invested in this technology and trying to design a device through which deaf can hear through their skins. So basically the main idea is how deaf people can listen. Basically this particular device catches sound waves like vibrations and convert them in brain signals. Still, as I mentioned earlier, it's not basically something that is available, still in research phases. Next is the neuroprosthetics. A neuroprosthetic is basically a study. It's basically a study in which replaced, or you can say artificial body parts can interact with person's nervous system. So they can control the artificial body parts with the help of their brain as well, just like the normal, or you can say the natural body parts. Next is the finger reading. Finger reading is a very excellent project specifically designed for the blind people, visually impaired people. The company who has designed this particular device is called Fluid Interfaces. So Fluid Interface is basically a company which is founded by MIT graduate. So there's an MIT grad who has founded this company, and what they have designed. So they have designed a device through which deaf, blind people, blind can understand the printed text. The printed text. So it's not basically a complicated design. It's a very simple design where what you have to do is blind people, they just have to put on the device on their finger, and there's a camera mounted beneath or under the device, and it scans and read out the printed text. So basically a camera is mounted under the device. Camera is mounted under the device that scans the printed text and read out. So the blind people, visually impaired people, they can also understand it. Next is the OOC, which stands for organ on chip. It's the organ on chip, which mimics cells, tissue characteristics. So basically, like you can design, I mean, it can mimic as a liver, heart. Again, it's kind of it's a small embedded device, electronic circuit, which can mimic as your liver, heart, and all that kind of stuff. The best thing is it allows doctors or scientists to actually develop drugs without testing them on animals or human. So they don't have to actually test those the medicine, because whenever we develop or develop a drug, we need to actually test what could be the reactions on the human body, and we just, I mean, after that careful study, then we can launch that particular medicine. But with this technology, organ on chip, we can design electronic circuit or electronic chip which mimics, which have the same characteristics as a human body. So you can develop the drugs by using those particular chips, in fact. The leading companies are the leading manufacturers. Leading manufacturers are, one of the leading manufacturers, Heprigen, then Organ Ovo. Please remember these, and Notis. These are the three main leading companies of organ on chip. Next is the CRISPR, which stands for clustered, regularly interspaced short palindrome repeaters. So this particular technology is basically a genes editing technique. It's a genes editing technique, and some people, they believe it can cure cancer one day. One day it can cure cancer. So this is basically I mean, as of today, that's the technique some people believe it can cure cancer. What it does, it uses the bacteria's immune system to edit genes, individual genes. So this is all about the healthcare application. Next is the cloud-based application. Everything on demand. I think everybody is well familiar with the cloud-based content. For example, Netflix, YouTube, or Amazon Prime. So all these Amazon Prime, etc., etc. There are many platforms like this where you don't have to download any contents. You can watch the contents uploaded or available on those servers, and you can actually access on demand. Another very important feature is replenishment system, which is introduced by Amazon, and they named it Amazon Dash Replenishment System. Amazon Dash Replenishment System, Amazon DRS system. And what exactly Amazon DRS is? Printers or coffee machines I mean, if you purchase a DRS based printer, and for example, if printer is running, supplies of printers are very low, so printer can actually place an order automatically to Amazon before the supplies will run out. So before supplies run out, the machine will place an order to Amazon automatically. Machine will place the order. Okay, this is everything on demand, and especially the replenishment system. The last few things. Next is the facial recognition payment technology. It's a very interesting innovation where you can actually pay with your face. Like, you don't have to carry a credit card, debit card all the time. What you have to do is, you just have to, if you purchase something, at the point of sale, there will be a device which will take your picture, send the picture to your bank or the financial hub, and then they can actually take out the money from your account. So this is a new kind of technology where we can make the payments through the face. And again, if anybody tried to trick the system, there is always a liveness test. For example, if you purchase anything from Amazon and you are trying to put your dad's picture, you want to purchase something from his account or your mom's account, for example. So what's going to happen if you put the picture right in front of the camera? It will not actually let you, because it detects the liveness in your environment. Self-driving trucks. Like, usually we use this self-driving feature on highways, and what they use is the self-driving truck use the LiDAR technology that further uses pulsed radar, like, which frequently send the laser light signals and gather information about the environment. So how does it work, in fact? So what happens, the trucks, they actually send, they broadcast, or they frequently broadcast the signal in 360, like from all directions, and then when the signal strikes with the next obstacle or next vehicle or object, then they actually reflect back to the main computer of the trucks, and then it controls the speed and all that stuff. So this is basically how self-driving truck work. Last but not the least is the blockchain method. We'll discuss blockchain in detail in our part 2, but just to give you a basic definition, blockchain allows people to share digital ledger across the network of computers. One of the example of blockchain is cryptocurrency, like your bitcoins and all these cryptocurrency. These are the examples of blockchain. We'll discuss blockchain in detail, how this ledger works, in our next class. So that's it for today.